One of the Wall Street Journal's headlines yesterday was global coronavirus cases surpass 300,000. That's not news, and I'm going to tell you why. Back when this all began, a doctor in Coram Deo said to me, hey, public health officials based on modeling expect that 30 to 50% of the population will eventually be infected with this virus. That's the expectation. And that 1 to 2% of those are going to require hospitalization. Okay, so let's do some math. The Omaha metropolitan statistical area is the 59th largest metro area in the country. Its official population is 944,000 and change. So let's just round up and say 1 million people. Okay, so in our own city, what's going to happen is 300 to 500,000 people eventually are going to contract the COVID-19 virus. That's the assumption. If anything less than that happens, it's a huge win for us in terms of public health. Okay, 1 to 2% are going to require hospitalization. So that's about 10,000 people or so. Now, all we want to happen is for that not all to happen at the exact same moment, right? If that happens over the next 4 to 6 months, that's fine. What we're trying to stop is that happening all at once. So here's what I want you to hear. As you hear every day on the news, the numbers are going up. The numbers are going up. You should not be surprised. We've always expected the numbers to go up, okay? That is not cause for concern. It's not cause for alarm. You should expect every single day the numbers are going to continue to grow up. We're not trying to stop the spread of the virus. We're trying to slow the spread of the virus. So as numbers go up, there are ways in which it is concerning, but it is not unexpected, nor are we entirely unprepared for it. Again, we're trying to slow the spread of the virus. What we want eventually is for the number of new infections to stabilize so that we can stay ahead of it medically. Now, these numbers are 24 hours old, and so I'm sure they'll be revised later today, but as of yesterday, the number of infections in Douglas County was 34, and in the state of Nebraska, 49. Again, way less than you're seeing in other places in the country. However, you're going to see those numbers go up as well, and let me explain why. We are increasing every single day the capacity for COVID-19 testing. There are more and more people who are able to be tested as more and more tests roll out. And because we know that there's lots of people who are probably carrying this virus and we just haven't confirmed it yet with a test, the more we have capacity to test, the more you're going to see those numbers go up. I received an email this week from another doctor in Coram Deo who practices clinic daily. And what he said is that he's receiving advice now that he's allowed to do what he calls the eyeball test, to basically diagnose clinically that people have COVID-19. What that means is, as a doctor, you're allowed to look at the symptoms that people have, and even without an objective COVID-19 test, to say, hey, based on your symptoms and what we know about your medical history, we're going to diagnose you as positive. So as we see clinical testing come online, as we see the number of COVID-19 objective tests grow, we're going to see more and more people in our city that confirm that they have this virus. Again, that in itself is not cause for concern because we're expecting that. What we want is to slow the growth, and especially for the people that need hospitalized care, for us to be able to respond to that. I've heard from a lot of folks in Coram Deo this week in the medical profession who are really feeling it because their colleagues are having to quarantine because they've been exposed to the virus, and so they're down as far as manpower. They're being asked to work longer hours. Many of them are concerned about their families because they're exposed to this virus every day as they practice their vocation, and then they've got to figure out, how do I protect my family as I come home to rest? And so these are ways you can be praying for the medical professionals in our city and in our church. Now, we are on day 8 right now of the president's mandated 15-day measures throughout the country to sort of slow the growth of this virus. And so what that means is we have another week of at least of the same practices we've been practicing, of no more than 10 people gathering in public places and things like that. The hope, and in fact in the news conference that the coronavirus task force held on Saturday, the hope is that more and more tests will be released every day. Tests meaning like the actual capacity to run a test on you for COVID-19. Obviously, a place where America is behind right now is in the capacity to test people for this virus. Here's where we want to get. Here's why ramping up testing is a really good thing. Here's why, as you pray, you should pray for God's grace on the availability of COVID-19 tests. Because the faster we get to the capacity to actually test everyone who we suspect is sick, the quicker we can get to where everybody doesn't have to be quarantined. The way that epidemiologists and infectious disease specialists want to attack an outbreak like this is, first of all, just to isolate anyone who has symptoms so that we can slow the spread of the virus, but eventually to be able to test people so that we know who actually has it and is contagious, and we can quarantine the sick people rather than quarantining all the healthy people. And I know that if you're healthy right now, you're longing for that day to come. You want to know, when can I go back to a relatively normal life in a way that doesn't ignore the impact of this virus, but that doesn't treat me like a sick person when I'm not sick, okay? All of that will come as we are able to increase the capacity of testing, and as our medical labs and doctors' offices all over the country are able to test with greater precision and immediacy people who show up who have symptoms or who they suspect are sick, all right? So we're on our way to 7 days ahead of more social isolation measures. By the way, let's not call this social distancing, because that's not what it is. Social distancing is when you keep 6 feet away from the people around you. When you can't go to work because you're being asked to work from home, and when the bars and restaurants are all closed, that's a certain kind of limited quarantine, okay? So that's really what we're facing. And again, the general public health wisdom says that's an important thing for us to do right now to really sort of limit the spread of the virus. So we have at least 7 more days of that nationally, and possibly more. And what that means for you and me is that our worship this weekend is going to look sort of like it did last weekend. We're going to continue to do living room liturgy. I hope you enjoyed doing that. Again, I'd love your feedback if it was useful or helpful, if there's ways it could be tweaked or made better. I want to thank our team here at Coram Deo for all the work that they put into creating that resource. I had a lot of fun doing it with my family on Sunday. I led worship. My daughter played the ukulele, played along. We worshiped in our living room, and we'll do that again this coming Sunday. So you can look forward to at least another week of that, probably more. But again, things change daily in this whole deal. So what I want you to hear as you sort of watch this briefing and sort of head into another week is, hey, one day at a time, and stop freaking out when you hear that cases are going up and infections are going up and more people are being infected. That's what we actually expect. And again, the good news with this virus is that it's not dangerous to most healthy people. The populations it's most dangerous for are those with underlying health conditions. And again, for the sake of our medical professionals, doctors and nurses, and those working in hospitals, we really want to honor the desire to slow the spread of the disease so that we do not overwhelm our medical capacity. I know you've been hearing about things like shortages of masks and respirators and all of that, and we're aware of all of that as a church. And as we become aware of ways that you could help specifically with things like that, I will reach out and let you know. Until then, let's keep praying, let's keep hoping, let's keep trusting the Lord together. I'll see you tomorrow for another daily briefing.